The Voice Vista Podcast, venture by Pooja Prasoon. The Voice Vista presents Candid Podcast Show Special Talks. प्रिव्हेंटिव्ह हेल्थ केअरमध्ये अतिशय महत्त्वाची भूमिका असते ती पॅथॉलॉजीची. अतिशय झपाट्याने बदलत असलेलं वैद्यकीय क्षेत्र आणि मॉडर्न मेडिसिन यामध्ये पॅथॉलॉजी लॅबोरेटरीची महत्त्वपूर्ण भूमिका आहे. या स्पेशल सब्जेक्ट संदर्भात आपल्यासोबत संवाद साधणार आहेत MD पॅथॉलॉजी, लॅब डिरेक्टर अँड कन्सल्टिंग पॅथॉलॉजिस्ट डॉक्टर सुचेताजी गंधे वळसंगकर. चला तर मग ऐकूया अ कॅन्डिड पॉडकास्ट शो स्पेशल टॉक्स.
Good evening to one and all. Initially, I would like to introduce myself. I am Dr. Sucheta Gandhe Valsangkar. I am a pathologist, MD pathology, with specialization in oncology. Today, I'm going to speak a few words on the topic early diagnosis and detection of cancers and genetic testing involved in cancers. Before I initiate my talk, I would like to share with you all a very small story that really catapulted me towards oncopathology. I got married in the year 2008 when one fine day my mother-in-law complained of a simple breast swelling. On examination, I found it to be a bit suspicious lesion. So I immediately took her for mammography, and then it was followed by a fine needle aspiration cytology. And as my sixth sense, or you can say as my suspicion was, it turned out to be a positive breast lump. It was breast cancer for my mother-in-law. What followed was a spate of diagnostic tests and then a surgery followed by chemotherapy and radiation. However, because of her awareness and alertness, the cancer that was detected was in the very early stages. It was a stage 2 cancer. So she survived and she bore the cancer treatment very well, and till date she is disease free. My whole purpose behind sharing this narration is that early diagnosis of cancers can be extremely useful to all the patients. As you all know, cancer develops very silently. The incidence of cancers is increasing day by day and across India as well as the globe. 1 in 9 individuals are developing cancers nowadays. The most common cancers that are encountered are different in men and women. In men, the commonest type of cancer is the oral cavity cancer, the prostate cancer, and the lung cancer, while in women, breast cancer followed by the cervix cancer and colorectal cancers are common. Now, before coming to the core topic, let us briefly discuss about the risk factors that are involved in the development of cancers. These risk factors are of two types, that is modifiable risk factor and non-modifiable risk factors. So modifiable risk factors are those that can be modified by lifestyle changes. These include consumption of alcohol and smoking, which contributes to 30% of the causes of cancer, followed by pollution. The next common risk factor is the sedentary lifestyle, consumption of very high calorie intake food that is rich in carbohydrates, and lack of physical exercise, which again contributes to 20 to 30% of the risk factors of cancers. Some cancers are hormone dependent, which is again a risk factor, that is hormone dependent cancers. Some cancers develop in chronic infections like HIV, human papilloma virus, hepatitis virus, and so on. And the non-modifiable risk factors are the risk factors related to inherited cancers or that are transmitted through genes. Now coming to the core topic, that is early detection of cancers. Why do we emphasize so much on early detection of cancers? When the disease is not very large and when it has not spread in the body, the chances of successful treatment and longevity of life are more. So, early detection of cancers plays a very important role. It is aptly said that nip the disease in its bud. Now, early detection of cancers comprises of two components. That is, first, making an individual aware of the changes in his regular body habits by creating literacy about cancers, as well as educating the health professionals. And the second component of early detection is the improved accountability and accessibility to health services and diagnostic tests. Now, knowing the signs and symptoms of cancers. Any individual can be made aware about his or her changes in the regular body habits if he or she notices the following signs and symptoms. If there is a regular change in the bowel and bladder habits, if a person suddenly notices an increasing lump or a thickening in the body, if there is an abnormal size of warts and moles, then there is sudden change in the voice with hoarseness of voice, then there are non-healing ulcers which are in the oral cavity as well as in the throat, then persistent fever, then indigestion and bloating and difficulty in swallowing. So these are the most alarming signs and symptoms for any malignancy or any cancer. Screening for malignancy. Coming to the screening of malignancy or screening of cancers, it consists of a number of blood tests as well as pathological tests and radiological tests that help in the early detection. Early screening of cancers is particularly relevant to those of breast cancers, then prostate cancers, cervix cancers, colon cancers, and lung cancers. The most widespread cancer is the breast cancer. So first we touch the aspect of breast cancer screening. So as per the WHO and the NCCN guidelines are the National Cancer Comprehensive Network guidelines. So as per these guidelines, breast self-examination is the first and foremost thing that a patient or an individual can do at home. That is, as the name itself is explanatory, examination of one's own breast. And this should start at the age of 25 years and should continue till the age of 40 years. And if you find any suspicious lump in this age group, then consult your clinician for a clinical breast examination. Then the second, as per the guideline, the second age group and the most important is the 40 years and above age group. In this, detection of lump, any breast lump is mandatory with the help of mammography screening as well as other diagnostic tests. So, an annual clinical breast examination along with mammography should be done every year for a woman above 40 years of age and should be continued till 55 years of age. And above 55 years of age, a biennial mammography is expected. Mammography continues to be the gold standard for detection of cancers. Mammography can pick up dense breast lesions, and these dense breast lesions are predisposing for malignancy, or they are precancerous breast lesions. Apart from mammography, there is breast MRI, there is breast FNAC, wherein the cells of the breast lump can be studied and can be used to diagnose the cancer. Then digital breast tomosynthesis. This is the latest modality which has come up in the market, and it is a three-dimensional viewing of the breast from all the angles, which helps in the diagnosis of any breast lump. And apart from this, there is a detailed family history that should be taken from the patient to rule out any genetic cancers if they are present. And if the family history for genetic cancers is there, then the patient should go for mutation studies as well. This is all about breast cancer screening. Then the second cancer that comes into discussion is the cervix cancer. So as you know, cervix cancers are common in females who have been infected with the HPV or the human papilloma virus, and women who are HIV positive. HIV positive females have a 6 times more increased chance of developing cervical cancers. The best screening tool for CS cervix or cervical cancer patients is pap smear. So with the help of pap smears, the cells at the cervical or the cervix are picked up and are studied under the microscope. And any abnormal cell or any abnormal morphology of the cell is reported and the cancer can be detected. So screening for CS cervix can be started as early as 21 years and it should be repeated after every 3 years. However, after the age of 40 years, HPV DNA testing along with pap smear testing should be carried out every 3 to 5 years. As per the latest government protocol, vaccination with the CS cervix vaccine, that is the Gardasil vaccine, has been highly recommended for females who are between 9 to 14 years of age group or school-going girls. This will definitely help in preventing the cervix cancers in the future. The other screening tests, apart from pap smear and HPV DNA, continue to be the colposcopic examination of the cervix, wherein there is magnification of any cervical lesion if it is present, and the visual acetic acid test, which helps in early pickup of the condition. The next cancer that we are going to discuss about is the male prostatic cancer. So screening for the male prostatic cancers should start at 40 years by tracking down the serum PSA levels. So what is PSA? PSA is a prostate specific antigen which is circulated in the body when a patient starts complaining of an enlarged prostate or has difficulty in passing urine or micturition. Then apart from PSA, the digital rectal examination, the MRI prostate, this also can help in early detection of prostate cancers. Then the next cancer that we will talk about is the colorectal carcinoma. Screening for this colorectal carcinoma should start at 40 to 45 years of age. The individual should look out for any change in the bowel habits, any blood in stools, weight loss, indigestion and bloating. The stool should be sent for examination and for occult blood determination. And apart from this, radiological investigations also help in detecting the colorectal cancers. And the last cancer that we will be talking about is the lung cancer. Screening for lung cancer should also start at the age of 50 years and should continue till the age of 80 years. Any abnormal cough, blood in sputum, weight loss with persistent fever should be reported immediately, and a low dose CT scan of the chest should be performed to rule out any lung lesion or lung tumor. Now, what are the important blood tests apart from these screening tests? So, a complete blood count should be performed on an annual basis after the age of 40 years. A complete blood count can help to pick up malignancies like leukemias, lymphomas, and other hematological cancers. Then blood protein tests, normally blood proteins are unusually high in hematological malignancies, so they should also be performed on a regular basis. Then tumor markers, these are most important. Tumor markers like CA125 help in early detection of ovarian cancers. Then, as we already discussed, tumor markers like prostate specific antigen or PSA help in detecting prostate cancers at the earliest. And the last blood test is the CTC, that is circulating tumor cells. So liquid biopsy has to be performed wherein the circulating tumor cells in the blood are counted, and these circulating cells, if they are present, they indicate the presence of a cancer. These CTCs are mostly useful in cancers of breast, prostate, and colon. A low level of CTCs helps in knowing the good prognosis of the patient. Now I come to the last part of my talk, that is genetic cancer testing. This testing looks for inherited changes in a person's gene that increase the risk of cancers. So around 8 to 10% are genetic cancers. Genetic cancers are those cancers that run in families. The sample that is required for genetic testing is a blood sample or a saliva sample. Now, who should be tested for genetic testing? It is not mandatory that all individuals should be tested for genetic cancers. There is a list which shows that genetic testing should be performed in few individuals only. So, who are these people? So, basically, family members with a known inherited genetic change should be tested for genetic testing. Young age cancers, then rare types of cancers like a male breast cancer should be tested for genetic testing. Then different types of cancers in the same individual. For example, a breast cancer and a pancreatic cancer occurring simultaneously in an individual. Then birth defects with some inherited cancer syndromes, and individuals who have a cluster of some cancers in family linked to a single gene mutation. For example, the BRCA gene. We talk about the BRCA gene, the most commonly and the most familiar gene that everyone is the breast cancer gene, also known as the BRCA gene 1 and 2, which is related to breast, ovary, and pancreatic cancer. The last point that I would like to cover here is there is a persistent debate going on about genetic cancer screening. Should genetic cancer screening be a part of the regular cancer screening programs? Well, the answer to this is no. Genetic cancer screening should not be a part of the routine cancer screening programs that usually start after the age of 40. And as we discussed, individuals with only the above mentioned risk factors should be screened for genetic cancers. Here I would like to quote an example of a very famous Hollywood star, Angelina Jolie, who underwent a prophylactic mastectomy just because she had the BRCA gene positive in her. And why did she go for the BRCA gene testing? Was because her mother was also tested for BRCA gene and she was positive. So, under such circumstances, if you are genetically predisposed to certain types of cancers, then only you can think of genetic testing. Otherwise, it should not be included in the routine cancer screening programs. To conclude, in this era of digitalization, we are exposed to so much stress in our life, and more exposure to risk factors predisposes to cancers. We have to be vigilant and aware about our health and cancers in general. 40 years and above is the age group which is maximally exposed to or maximally at a risk of developing cancers. So screening should be upfront after the age of 40 years. A slightest change in the body habit should be brought into the notice of the individual as well as the health provider or the doctor whom we are comfortable with. And lastly, early detection and diagnosis of cancers not only improves the longevity of the life but also improves the quality of your life and your family members. Thank you so much.
Thank you for tuning into the Voice Vista podcast. आप और भी इंटरेस्टिंग शो सुन सकते हैं thevoicevista.in पर। ये शो कॉन्सेप्चुअलाइज किया है पूजा प्रसून ने, प्रोड्यूस किया है द वॉइस विस्टा ने। गेस्ट कोऑर्डिनेशन में हमारे साथ रही सुनीता जी चौहान। डिजाइन किया है टीम क्रिएटर्स डेन ने। साथ ही एडिटिंग और प्रोडक्शन के लिए धन्यवाद टीम लर्निंग बी को। प्रोमो वॉइस दिया है राहुल ढोले ने। लाइक, फॉलो और सब्सक्राइब करना ना भूलें।